The Water and Sanitation Program, WSP, is part of the World Bank's Water Global Practice, whose goal is to ensure that poor people gain access to affordable and sustainable water and sanitation services. The WSP is currently involved in 25 countries via regional offices. Our focus will be India because of how many people are affected by the lack of adequate water and sanitation. According to the WSP India report, sanitation is defined to include management of human excreta, solid waste, and drainage. To this day, India has the greatest prevalence of open defecation in the world. As a result, people are exposed to fecal oral pathogens that develop into deadly diseases. The lack of sanitation that exists in India has severe economic impacts for the country. In 2006, roughly $29 billion was foregone due to premature deaths, most of which were attributable to diarrheal and other diseases caused by unsafe waste disposal methods. This study's scope of sanitation includes the management of human excreta and associated hygiene practices in order to improve elements such as health, water, toilet access, and tourism. In order to eliminate the deaths attributed to these practices, WSP promotes its efforts at several political levels. The study focuses their efforts on three main goals. The first goal is to increase political will and administrative commitment by identifying and creating local sanitation advocates at the district level. Strategies such as exposure visits, evidence-based awareness campaigns, and sanitation policies and operational guidelines are the main plans to achieve this goal. The second goal is to provide technical support to chosen districts that is tailored to their size and needs. The program plans on implementing district-level demonstration projects, creating a scale that is significant enough in a country, and providing action learning cycles and evidence building. The final goal is to strengthen state governments' institutional capacities to replicate this model in other districts. Long-term plans include covering the entire state. This program excels in highlighting the importance of water sanitation on reducing morbidity and mortality, mitigating impacts on drinking water, improving welfare, and reducing impacts on tourism. This program focuses on a monitoring framework that measures toilet coverage, sewerage, and the number of wastewater treatment plants and their effects on health, water-related, environmental, and welfare indicators. The results of this study indicate the economic losses developing countries, such as India, face. While studies can raise awareness to the issues presented by inadequate water and sanitation, governments of developing countries may not prioritize these issues and enforce policy changes. Government structure, corruption, and geographic and climate differences across regions of the globe make it difficult to develop a comprehensive strategy to fight inadequate water and sanitation globally. As a result of the WSP's efforts, the Indian government has made investments in sanitation since the mid-1980s. Since its inception in 1999, India's national flagship program, the Total Sanitation Campaign, has achieved great success and now covers all districts of the country. It is one of the most effective rural sanitation programs in the world. In 2004, the campaign began rewarding local governments with a fiscal award when they achieved total sanitation. Still, priority was not given explicitly to urban sanitation until 2008, when the government approved the National Urban Sanitation Policy, which emphasizes developing sanitation strategies, helps local governments prepare citywide sanitation plans, and makes investments in infrastructure and software to improve urban sanitation. A 2009 and 2010 National Sanitation Rating Survey illustrated that cities have increased awareness regarding urban sanitation and encourage action from local governments. In conclusion, studies show that the efforts of the water and sanitation program in India have resulted in critical investments being made in both rural and urban sanitation. Sanitation interventions have proven to have beneficial socioeconomic returns to households and society, contribute to improved health and environments, and increase dignity and quality of life. WSP programs can theoretically be implemented anywhere. It is more a matter of the local governments complying with the WSP. Once local governments are on board, there is no reason that over time water and sanitation shouldn't improve.